There's sometimes animals that you could save, but it would cost a lot of money. And people don't have the means always to do that. I've heard sentences like, well, I won't pay rent this month. No, wait a second. You're not gonna not pay rent. Like you have to live. The hardest question is when people ask you, what would you do if it was your animal? I would be sitting on the floor crying right now if it was my animal.
What happens when the emergency doors swing open and everything hits at once? The critical patients, the panicked owners, the pressure to make the right call. How do you hold it together? And what happens when you can't? Welcome to the Pause and Effect podcast. I'm Dr. Kara, and this is the podcast where we go behind the scenes of veterinary medicine to talk about the stuff that actually matters, the real conversations, the hard ones, and the ones we don't always get to have. Today, I'm sitting down with Dr. Brianna Tobin, an emergency veterinarian, educator, and the person behind Emergency Pet Vet. Brianna lives and breathes the ER, the overnight shifts, the impossible calls, the moments that break you, and the ones that remind you exactly why you do this. We talk about what it really takes to work in emergency medicine, from managing chaos and supporting your team to navigating tough conversations with owners about money, prognosis, and saying goodbye. She's honest, she's direct, and she's got some things to say that I think every vet and every pet owner needs to hear. A warm welcome to the Pause and Effect podcast.
Thank you. I'm happy to be here.
It's very exciting. I can't wait to talk to you today because you are an emergency vet and you're an educator. So, I've spoken a little bit about emergency medicine and critical care and surgical cases before in my podcast. But what I haven't spoken about is really how to deal with the stress of that, how to have a high-performing team, how to manage things when they go wrong, how to manage client expectations. So I'm going to throw those kind of questions at you today in the hope that you've got some insight.
I love it.
Great. Thank you.
I hope so.
Yeah, you would hope so. So before we go into the topic, tell us a little bit more about you. How did you sort of find your way into emergency veterinary work?
I have to say it's from the beginning. So when I was actually, my dad's a family doctor, and I knew I wanted to go into medicine. And I think I had that notion at the beginning, like a lot of people do, like, oh, I'm too sensitive to be a vet. I like animals too much. But I knew I loved medicine. I was like, oh, how can I have to combine these two things, right? So from the beginning, starting vet school, I knew I liked emergency. I liked high-paced things. That's the way my brain functions. So when I did my internship, I did it as a rotating, but it was primary emergency. And right after that, I went and started working emergency, and I've just stayed there since.
Crazy. I mean, we'll get to that, but I mean, is this something that you see yourself doing longer term?
I think so. I know the repercussions you can have, right? Because of the hours. I think that is the biggest thing. I have 2 young kids too.
Oh.
Even though everyone says it gets to be easier as I get older, right? Yeah. But I think the biggest concern for me staying in emergency is the overnights and those crazy hours on my body. But work-wise, I cannot see myself doing anything different.
So I really resonate with this because I started off my career in the UK working as a general practitioner, and then I came back to South Africa, which is where I'm podcasting from. And for 8 years, I worked as the emergency vet. So also the night shift, but I loved, and everybody was like, how did you do that for so long? It's not healthy, mental health, and whatnot. But like you, I love the cases. I love the pace. I enjoyed just the work that I was seeing. Obviously, the negative is the fact that you are doing a lot of antisocial hours. But
I know, but sorry, I didn't want to interrupt you, but I will say for me, and I know people sometimes find this crazy, and I know, you have to work weekends and all that, and it does take a toll on your family life. But because I really like working, let's say, swing shifts, because I get to wake up with my kids, take them to school, run errands, see friends sometimes, and then go to work. So I know it's not great like that, but I find that for me, it's more of a struggle sometimes working that 9 to 5. Because then I get home and with young kids, and then it's evening time and I'm exhausted because I'm never up late if I'm not working. I'm like a 9 o'clock into bed kind of girl. So I find that it actually gives me much more flexibility with regards to my life. And maybe it's because a lot of my friends also have weird hours, but
I totally agree.
it really works for me.
Yeah, and I mean, I think the reason why I was able to also justify it or enjoy it or have it sort of expand over 8 years was the same. I was always like, I'm otherwise missing out on the birthday lunch or, the school pickup, or if I was working day shifts. So the benefits of, especially with young family, of being able to do some of those things, to attend the school functions, or to be available if they're sick and to pick them up. All those things are great benefits of working the antisocial hour shifts.
I know. And I will say we do also, I don't know if it's unique, but so we have a great team and we're a really big team. So we try to support each other a lot. And I know this can kind of delve into the whole teamwork thing, but if someone needs, like one of my coworkers just wrote on our group yesterday, hey, my kid has something in a few days. It was out of the blue. Can someone take my shift and we'll swap? And of course there's someone not working, and someone took her shift so she could attend her kid's recital. So in my opinion, it's so nice because also it gives us the flexibility to help each other, or someone wants to go on a spontaneous vacation, because it's very hard for us to plan our lives. And you switch around a few shifts and then you get away for 5 days. So for me on that aspect, I love it.
And that sounds like you have a good team, which is what we're going to talk about today as well, is how to cultivate a good team, because you don't have that situation that I've seen in other practices, which is very much about protecting their boundaries. Like no one's offering to do that shift. They're so burnt out that they, I can only do what I am anticipating I'm going to do and no more. And obviously there are concerns when you end up in that position where you're just having to say no to everything because you're vulnerable to, or you're concerned about, burning out, working too hard. You're feeling the stress of it.
Well, you're trying to protect yourself,
quite
right? You're trying to, at the end of the day, you're trying to protect yourself. Yeah. And I get it. And I think the culture is changing a lot. And, I mentioned before, because my dad's a doctor, and he talks about the way it was when he went to med school and they let him come out for a couple of hours when I was born. Yeah. That's all. Yeah. Like the culture is changing, right? And I hope that the more we talk about it, the more we can change this, so we can not just protect ourselves, but also help each other protect ourselves, right?
Yeah. And I think the concern, I'm a practice owner, so the concern is, the sustainability of a business, because there was the swing to very much, less is more. I don't want to be working so hard. I want to have a family. I don't want to be working long shifts, and trying to adapt at a time where, there was still the demand. We didn't have a roster that could accommodate that. So there are a lot of things that have changed even in South Africa. And I suspect we're a little bit behind, and we've got a lot of lessons to learn and, ways to improve that kind of workflow and roster sort of setup. But I think it's important that you do work to try and have something that is more sustainable, both from businesses and for careers.
Yes, exactly. Because at the end of the day, I think we put so much effort and time into studying, right? And into our career. And you want it to be a long career. So I tried GP for 1 year while trying to get pregnant, thinking, let's see how this goes. Maybe that's what I need. I need this. And it just didn't work for me. It didn't. I gave it a shot and it just wasn't for me. It actually put more stress on me in a way that people didn't really understand why, but for me, it wasn't right for my lifestyle. So I think also finding what works for you within this, right? We're all so different, and not everyone's the same.
You look at me, I look at you, I see the love in your eyes.
Health you can see, love you can feel. UltraPet, the science of love.
So what was it about the GP work? Because again, I can totally relate to this, and I'll tell you my feelings about it, but what was it about working GP sort of normal hours that kind of just made you realize this is not my scene?
So I think it was a combination of a few things. One, it was the hours. It was the 8 to 5. right? It was the 8 to 5. And I the waking up in the morning, going to work, coming back, it just didn't work for me. I felt actually that I had less time to do things for myself, like working out or just doing things that I like doing when I was working those hours. The work itself, I need excitement. And it's not that GP can't be exciting, because it can. It surprises you, right? And I do locum GP sometimes. And to me, it actually is a little more stressful having those appointments that I have to keep up. Not like an ER where I'm notorious of picking up, if it's busy, I'll pick up 4 cases at the same time and get the ball rolling on everything. But you can't do that in GP, right? You have to keep your appointments. People are waiting. They have a set time. So that was more stressful for me. And to be honest, I was also on call. And I promised myself when I started this career, because of my dad that used to have to be on call to go deliver babies, that I wouldn't be on call. I wanted to be off when I was off. So specifically that GP practice that I was at, we had to share the on-call. And for me, that was much more stressful, because I just wanted to put my phone aside when I got home and focus on everything else. And when I'm at work, I'm focused 100% at work. So that was for me, but I'm interested to know
that makes sense. I was a little bit the same. So, having those appointments, and I must say, and total respect for the GPs. I have to do that little disclaimer here. Or anybody listening going like, no.
It's hard. It is. I struggle more when I locum GP than when I work ER.
And I totally admire the way that they maintain their enthusiasm, because I like to be quite thorough. And so, if there's a vaccination, I want to do the full, the comprehensive advice and care and whatnot.
Yes.
So I pride myself on being able to do that. But what I found is I was getting bored with my repetition. I was like, I can't keep doing this conversation. It was just depleting. And then probably the other thing that used to irritate me was I would look at the day and I'd be like, okay, I've got Mrs. Smith coming in at this time and I've got this one coming in, and I would plot out my day, and then I would get irritated if there was a walk-in. And I see it happening with the GPs here. There's something in your psychology you have to really adjust to say, they need me. Obviously, they didn't anticipate their pet was going to get sick. They need to be seen as, but for whatever reason, I think it's probably a stress response, to now try and slot them in between.
Most likely, yeah.
I was just, I would get myself like, oh, this is not what I kind of, and I wasn't then delivering my best. So I knew that, I'm a bit like you. I would rather be dealing with 4 cases at the same time and sort of be triaging and managing that than to have that additional. And even if it's in a appointment slot where I thought, okay, well, I'll now just go and check on my patients at the back and manage those cases, and then I've got So I was getting very frustrated, and it didn't make sense, and it wasn't fair. And that's when I was like, either I need to adjust my attitude, or I need to get out of doing GP work. And obviously, the emergency work was calling. So. Yeah, that was like,
and I think, we always talk, people like to say, GP versus ER and all these things, but we're all so different, right? We're so different. We have different personalities, different triggers that stress us out. So things that could stress, let's say you and I out at GP, when someone that does GP thinks about doing ER, other things stress them out. So we at the end of the day, there's so many opportunities in this profession as well that you have to find something that works well for you.
Absolutely. And there's enough to go around. So we need
exactly
people to do the emergency work. And there are a lot. Our practice has a bit like you were discussing. We have vets who maybe will do not on call, but will do some night work. And there are some that just really don't enjoy doing it. And obviously from a rostering perspective, it doesn't make sense to give them work that they don't like. I would rather have them here where they're enjoying and they're contributing and they're productive and they're happy than to be resenting any work that they're doing. So I totally agree. If you can find your niche, whether it's, by pursuing some specialty, which is always very admirable, or, just trying to work with the hours that suit or the kind of work that suits you, it's a win-win. It's very interesting.
I personally, so I love the swing shift, right? I love the swing shift because I know I walk into, well, also because again, I have time in the morning, but I know I always walk into a busy shift and I love it. Like for me, that's not a stressful thing. That is I like it. And the building starts kind of, all the specialists leave in the evening and something about the energy changes. So you get the best of both, where there's still everyone in the building at the beginning of your shift. And then slowly it kind of transitioned to that. There's something, and I think people that don't do overnights don't understand, there's something about the overnight energy, the overnight team, the overnight energy that changes. And I love it. I love it. And you never know. It could be busy. It could be really slow, but there's something energy wise that shifts when it's overnight cases. And I can't put it into words, but I love it.
It's a feeling. so
it's a feeling. Exactly.
Talk me through what does a typical shift actually feel like? Describe the way in which you hand over and deal with cases.
So it depends. Like, again, we have a really, really big team. So if you're the day shift, we have kind of our treatment doctors and our incoming doctors. And then throughout the day, it's all incoming. And then the overnight doctor basically takes over, all the hospitalized cases and starts seeing cases at some point when you can. But we have a doctor there till 2 a.m. So a typical shift on incoming, basically the way we have it is we have a color system to grade things. So the green, yellow, orange, red cases. So usually, obviously, if it's a red or an orange, it's called as a priority. But you walk in and I check in, I see the other doctors and I say, hey, is there anything waiting? Is there anything critical that needs to be seen right now? Or can I put my things down and see what's happening? And then depending on the way that is, because it changes every shift, and then I'll go and just pick up a case and start. So some shifts, you could see 4 cases, 5 cases, have time to help each other. We help each other anyhow, but I mean be much more active in someone else's case if they need that help. And then some, days you're seeing 15 cases and trying to juggle all these like very critical emergencies at the same time. We also keep our cases till we round to the treatment or the overnight doctor. So basically you continue to manage your cases that you hospitalized while you're seeing more cases.
Okay.
But we're really, again, I really pride our team because we really are good. And if you look at also the doctors, most of the doctors have been there for years. Like they were there when I did a rotation in 4th year, some of them. And I've been out for 11 years now. So that means something, right?
It's a good sign.
We help each other. So I can always call on someone else. Like my typical shift, we're just asking each other, hey, can you look at x-rays? And then 4 people come behind you and we look at the x-rays together. Obviously there's less team throughout the night. There's less doctors on, but and in between, I have to say, we also have fun. Yeah. Like if I'm being honest about a shift, like we all try to have fun. And we joke around a lot and we tease each other. And I'm not just talking about the doctors, I'm talking about the whole staff. Because within that and that craziness of ER, at least what I try to do all the time is have fun. Mm-hmm. So my day kind of consists of obviously hyper focused when there's tons of emergencies coming in. But in between, I try to joke around a lot. To keep it light because it could get a little dark sometimes, right, on ER?
I can imagine. So how important is this team dynamic in the ER setting?
I think it's everything, in my opinion. I see this a lot when people ask me, but our team is so good, like our techs and our assistants, that if a dog comes in cardiac arrest or we need to do CPR, everyone is so skilled, they'll run a code without a doctor around. Now, obviously, we're all there involved, but it can happen. And they notice things like especially on ER, you have to trust your team. So if one of the techs that, let's say in treatment, tells me this cat is not looking right, they've been looking at that cat all day. I've been running around. They have been sitting in treatment, watching that, then you listen to them. And I think when we think about team dynamic, listening to each other and forming this good kind of combination between all the people that work there and being open to hear each other is what's going to make a hospital function well and animals get good treatment and good care. Because if you don't trust each other and you don't have this good dynamic, then you're not listening to each other.
So true. So true. So what makes a team function well, particularly under pressure?
I think communication at the end of the day. It's all about communication, right? Like if people feel comfortable talking and knowing that they're not going to be dissed or that's not important. If you can communicate with each other, then I think that is the most important thing, because everyone knows what they're doing, what their role is. They're telling each other what they think, and no one's judging each other. So if someone tells me, I don't know, something doesn't feel right, or are you sure what you're doing? You can decide how you take that, right? You can take offense or you can turn around and be like, yeah, I am sure, but thank you. Thank you for telling me. Or I'm not sure, I made a mistake. Thank you so much for telling me, and not taking offense, because at the end of the day, we all have one goal.
Absolutely. So what are the biggest breakdowns you see in teams?
Oh, that's big. I think for me, it's when there's someone with energy that is difficult for a lot of people. So you can see how things will shift within a hospital setting or a team dynamic when there's a person that is just not, if they're not in a good place with themselves, how it affects everyone else. And I think that is one of the biggest breakdowns as teams. I'm not saying everyone has to be friends, but you all have to get along and work together. And if there is someone that cannot do that, for me, that is a huge red flag, much more than teaching, let's say, a new tech ER skills, right? You can teach, if someone's willing to learn and work together, you can teach that. But if someone doesn't work well within a team, for me, that's the biggest thing that can cause a breakdown.
I can imagine. I mean, you're obviously dealing with high pressure and high stress. Do you have situations where there is difficulty with individuals in this environment? I mean, how do you support someone who's struggling, say, in the middle of a shift?
So I think it depends who it is, right? Because like we said before, everyone's so different. So communication and learning each other, right? You learn each other's personality. So it's the same in any relationship. There's some people that I can say, hey, do you want to go outside for a second? Do you want to go get a coffee or something? Or do you need to go eat something? Like, just to help. And the same they can say to me, right? Hey, have you had a drink of water lately? So I think it depends on the person. And because if someone's struggling, you don't want to call them out and make them feel bad, right? You want to empower them, and you want to find the right thing that's going to make them feel good. So you're not putting them down, you're trying to help them. So I really think it depends on the individual and you knowing them, hopefully, and what you can do to help them feel better in that moment, or say, it's okay, we got this. You know what I mean? There's a lot of other patients that need some help too. And then they get that break to be like, oh, thank you, someone, for saying that, because the situation wasn't for me. Right? Because not everyone, I'm trying to think of it. I love golden retrievers. I've always had golden retrievers. And everyone knows that when a cute golden retriever comes in, no matter how busy I am, they're like, Brianna, there's a great golden retriever here. But sadly, we also see a lot of issues with golden retrievers that are sad, like hemoabdomens and pericardial effusions. And they know that if there is a non-ambulatory golden retriever coming in, ideally don't call me, because I get super emotional around it. And I know that obviously if it's me and I need to, I'll do what needs to be done, but they'll call someone else. And I think that is my team knowing me and trying to take me out of a stressful situation that they know is going to be a little harder for my heart to manage. So that's how we learn each other, right?
Yeah. So every team obviously needs a good leader, but what does good leadership actually look like in that environment?
I think, again, it's giving everyone their place, but still knowing what you need to do. So I think, again, it depends. Because if you look at leadership within management, then it's harder. And I'm not part of management, right? Like I'm on the floor. So I think for me, when I think about leadership or newer doctors or newer technicians, it's giving them room to ask questions and to communicate and to know that you got their back. Yeah. So we have a newer doctor that we all know her. She used to be a veterinary assistant, went out to vet school and came back. So we're all super excited that she's with our team now as a doctor. And I told her from the beginning, I'm like, don't ever feel bad about stopping me in the middle of something and asking me a question if you need to. And I think leadership, at least for me, is that it's giving room to someone to ask and to feel like they can, even when you're busy. Because I think automatically, as you're more of a senior doctor, you become more of a leader within this, right? People look to you the same as the senior technicians, the senior assistants. People look at them for knowledge and help when you're starting out. And you don't want to discourage anyone. So I think just being open for people to ask you questions and know that, there's no stupid questions. I really do believe in that sentence, because if someone's asking it, that means that they really are looking for an answer. Even if in your head you're like, oh, you should know that, right? But they don't at that moment. Maybe they forgot because they were stressed. So no judgment.
Safe space. Yeah, I agree. And how do you yourself build resilience? And like, what does resilience actually look like in emergency medicine?
So again, I think it's individual, right? But for me personally, it's trying. I won't say I'm very good at it all the time, but one, it's trying to step away from work when I'm not at work. Do I creep our treatment sheets sometimes from home? Yes, because it's digital, because I want to know if that patient lived. But I think that's number one, is when you leave, to do something that is separate. But also, I think it's working through those hard cases that didn't go the way you wanted them to. And because if you're dragging guilt or fear from the next time that case is going to go in, then you can't build up that capability to deal. So everyone does it differently. Some people talk to their friends, their therapists, but I think resilience comes within working through those things so you can build yourself up and be strong, so you can deal with it again. Because if you don't, then I don't know, the next time the next case comes in that seems the same, it might break you. Mm-hmm. And you are going to see some things that are hard on ER, right? A lot of things that are hard. Mm-hmm. So you have to find the things outside and in work that are going to make you feel strong and happy within yourself, and not let it get to you. And also be okay letting it get to you sometimes, but then work through it. Not just like shoving it aside. So like I cry still at work, and not because of a breakdown, because I was sad. And then I let it in and I let it go afterwards. So for me, that's what builds resilience, in my opinion.
What tends to break people in ER work?
There's two major ones for me that I see people that it's very hard for them. One is the amount of sick animals you see, right? Like you see the sickest of the sick animals, and we can't always save them. And it breaks people, because you get, almost everyone, or I would say everyone, is here because they love animals, right? And you get attached to these animals. Yes. And it's hard. It's hard because sometimes you're watching them decline. And I find it breaks your heart, right? Mm-hmm. Like it's hard. And the second one is the finances. I think for everyone, because there's sometimes animals that you could save, but it would cost a lot of money. And people don't have the means always to do that. I've heard sentences like, well, I won't pay rent this month. And I'm like, no, wait a second. You're not gonna not pay rent. Like you have to live. So let's find a solution. But I find that is something that's really hard for everyone to watch, is when you know how much they care, they love their animals, and they just financially can't do it. So I find that those are the two things that are the hardest on the team.
Can you take us into a moment where resilience really mattered?
There was a suspect animal abuse one. That broke a lot of us. That broke a lot of us. Again, it wasn't really proven, but we're pretty sure that that animal was hit, and at the end of the day, we had to euthanize that dog. And nothing was admitted, you know what I mean? But it was pretty clear what was happening there. And that was a big one. That was a big one because it touched on a lot of fears of people, of personal things that they went through in their own life. If it was another human being that was physically, abusive to someone, and I think that is one of those where it touches your personal life outside of work as well, where resilience was so big. And we don't see that a lot. I don't want people to think but that it's happened once in my whole career right now, and I've been doing this for 11 years. But that, I think, is the biggest time where I could think about where resilience had to come into play for many of us. To kind of mentally get through and work through what we were feeling with that case, because it was really bad.
Now, obviously, yes, and I mean, it's just, thank goodness we don't see those too often.
Yeah, we do not.
But you obviously in high stress situations every day, and I suppose stress is one of those also subjective words. But in an ER setting, how does stress impact decision making in the ER?
So I think it depends on the way you are with stress and what kind of stress, right? Because not that I think it's funny to say, good stress. I don't know if I would put good and stress in the same sentence, but I think if the stress you're feeling is, okay, I can get this done, it makes me move, then your decision making can be good. But if the stress overwhelms you, then your decision making won't be good. And that is when you need to stop and ask for help. So I actually had a case last week that I can't remember the last time in my career that I panicked like that. And I panicked. We pulled, there was a dog that was running after a ball, and he got a stick stuck. It was actually beside his eye. His eyes are pretty amazing, and it usually goes beside. And we pulled the stick out, and it looked like an arterial bleed. It was really bleeding, like a huge amount. And I put my weight in it and stopped the bleeding, and I couldn't think. And that is where, and I knew I needed to but I had that like 10 seconds of, okay, I'm doing what I need to do. I'm stopping the bleeding, but what? And I said, can someone get another doctor? Now, luckily there was another doctor to call. And if there wasn't, I'm assuming within 30 seconds, my brain would have started functioning well. But in that moment, my decision-making wasn't going to be good. I did what I needed to do to save that dog's life. But thinking of what else needed to be done, my decision-making wouldn't be good. So that's an example of a high-stress situation that was I did not see it coming. That my decision-making wouldn't have been very good if I tried to make decisions at that moment. I don't think I would have really done everything I could have done, where someone else came, they're like, oh, let's do this. And then my brain started functioning again. Oh, yes, let's do this as well. And again, the dog's doing great. So, everything is fine. But I think if your stress is overwhelming, your decision-making is not going to be good. And that's when you need to step away or call someone else.
So can stress actually affect patient outcomes?
I think so, yeah. And I think we don't always have control, right, over things, especially on ER. I walked into a shift the other day, and 3 stacked priorities came in at the same time, and I was the only doctor on the floor. So that happens once in a blue moon, but it happened. And I was lucky and everything was fine. And I was, high functioning at that moment. I didn't feel that stress, but maybe someone else would have felt, or someone that's, let's say, a newer grad would have felt a little more overwhelmed. And I do think it can affect patient outcome. I think at the end of the day, one of the things we need to think about when we staff our hospitals or our clinics is that you have enough people that if try to anticipate things that maybe can happen, that if one person it's too much, that there's someone else that potentially could jump in and help. But then I know as managers of hospitals, you're like, well, I'm not going to overstaff my hospital all the time for these potential things that can happen. I don't know.
It's a very interesting.
You know what I mean? You own a practice.
I'm sitting here going, obviously it's a bit, I'm going to take it away so that I don't, I'm not talking about vets because it might get too sensitive, but it's a bit like staffing.
Yes.
Going to be sensible here. It's a bit like staffing reception. You have times where there is nothing. The phone isn't ringing. No one's coming in. We have a little bit of retail space. No one's coming in to buy food. There's no email to deal with, and they're having downtime. And then just like an ER situation, everybody will walk in, the phone will start ringing, someone comes in to buy food, the vet needs to have admission forms signed, and it's all go. And I think, in those kind of situations, how many receptionists should you employ for those kind of, it doesn't last long. But so I think from a sustainability and from a, sort of, can you employ enough people and pay them and have the turnover that is going to support that over a long period of time, you've got to take those kind of things into consideration. The ideal is that you don't want to have a situation where that keeps happening. And if that keeps happening, for example, you get like 8 cases that come in and you're not managing them, then you've got to say, look, you're clearly understaffed. But I think those difficulties are, you need that personality type, or at least a team that can, like you say, whether it's the nurse or an experienced assistant who can at least be managing those initial sort of triage situations so that it buys you a little bit of time. It's a difficult one.
But that goes back right to teamwork, because if you have a staff that you trust and you communicate with, and that's, let's say, what happened in that situation where, yes, as kind of the doctor on the floor, I said, okay, I need, this, and this. There were such amazing people and on the floor with me that made it happen, right? Like I could have never done that alone. And then we looked at each other at the end and we're like, God, that went really well. Like, good job, everyone. Because like you said, you can't anticipate that. You can't overstaff all the time. But if you have enough people that can work together and kind of task each other to do things, then these situations are less and less. So hopefully you can improve patient outcome with that all the time.
It's trying to upskill and everybody to, and like you say, working as a team and understanding your team, which is just what I love about, how you're explaining that everybody knows their role, their strengths, even to not bring you the golden retriever. It's the anticipating what might actually derail people in those sort of situations.
Yeah.
So it's really, really important in a good high functioning team. But what are the kind of signs that someone is becoming overwhelmed? What do you look out for that sort of says, this needs to be managed?
So again, I do think it depends on the person, because everyone has their own tell signs, right? We show it in different ways. But I think usually when I see the most common is when there's, especially the newer technicians are trying to be, they're so, they're sweet and they're trying to help so much. 5 doctors will ask for things at the same time and they'll say yes to everyone, okay? Because they're trying to help, right? And they're being really sweet. And then I notice that people are not finishing what they need to do. And for me, that's usually a sign that someone is super overwhelmed, because you're giving them too much to do and they're not able to follow through, and they're just in the goodness of their heart trying to do too much at the same time. So that's a big tell for me on the floor, when things are just not being finished. And so I could see someone's getting super overwhelmed. They just can't get it done. Within the doctors, I'm trying to think, but I think it's so individual, right?
Do you ever see people getting angry? Is that something that you ever witness?
Yes, but not a lot, thankfully. right? So there are a few people at work that they can, yes, they can get a little angry, but we don't see it a lot. And I think that's like a big thing that we can give, credit to management, that they've, if there were people like that, they've tried to stop it the way it started, because they don't want that on the floor, because it will affect everyone. So I have to say, knock on wood, that doesn't happen that much at our hospital.
No, I only ask because obviously, we see particularly clients, and I suppose that's my next question. How often do you get clients who, because they are scared, become angry and forceful and snappy, and often, sort of very difficult to deal with?
A lot. No, I'm being honest, but I also, and this is also something my dad always told me, but you never know someone's background, right? You don't know what they're going through. First of all, I don't know what they walked in. I don't know if, let's look at a bad situation. Someone just separated from their spouse and their dog now isn't feeling well, and they had to come into the hospital and they're having the worst day of their life. So I always try to come in as clean as possible. Even when, someone else is doing the assessment and they're like, oh, so-and-so and, room 5 really isn't nice. And I'm like, okay, I heard you, but, and then I go in and I introduce myself, and usually I try to start off with, I bet this isn't easy right now and that you're super scared, and I understand. So let's just try to take this slowly, and I'll walk you through what we're doing today and try to help you as much as possible. Try to apologize for the time they've been waiting, because a lot of times they can wait a long time. I can remember twice in my career where I have kind of told someone off. Once when someone was yelling at the receptionist that she's stupid, and I walked out and I said nicely, but I said, hey, no, we don't talk like that here. And if you want us to help you and your animal, I really need you to ideally to apologize, but you're not 5. And please don't talk to her like that. And once we had a drunk guy that was getting a little physical, with closing on to one of our technicians. But those are the only, the instances when people are getting aggressive to a point where it's scary. You're scared for someone or for yourself. But in general, I find that we see people get worked up a lot, but it makes sense, right? So I think if you come in with kindness and understanding, 99.9% of the time, they calm down, because they see that someone's there to try to help them and their animal. And this most likely is a really bad day for them. They're paying a lot of money coming into ER, and they're super scared for their animal.
And there's nothing worse than seeing something you love struggling, in pain, critical. Yeah, especially when you're fearful of the cost associated with that. And I mean, we're having very difficult conversations.
Exactly.
I mean, I'm not doing emergency work at the moment, but it was this wasn't my first line, but obviously the conversation is very much like, are we going to, proceed with this workup, treatment, stabilization, because we know that as soon as we start that process, there is a cost associated with that work. And so often, you want to establish very early on whether these owners are in a position to afford it, because I think there's nothing that gets owners more uptight than not communicating the cost associated with it and just assuming either way, assuming they can't afford it and they would have, like you said, not paid rent the next month, or that they can, and actually we don't know what's going on in people's personal lives, and they are in a financial predicament. So I think it's so important to have those conversations. So how do you tackle those kind of conversations with your owners? Do you have to do it, or does someone else do it for you?
So I do. A lot let's say where I did my internship, we separated the estimates from the doctors, but we do. And so first of all, I'll say that I have learned throughout the years, and I always say no judgment. We all do that a little bit, right? We all judge a little bit automatically. You walk into a room and things go through your head. The question is, are these valid, not valid? And where do you take them? So you put them away. You're like, no. But because it's very easy to look at someone and say, know, she has a really nice bag. Like maybe, you know what I mean? Maybe they have money. People do that all the time automatically. And you have to not do that because you have no idea. You have no idea. You don't know if someone has money, doesn't have money. So first of all, I always offer everything. I say, ideal world, this is what I would do. Here's your estimate. You know, this is what I would do. This is the cost associated. And I always give them the out from the beginning. I say, why don't we go over this? You let me know if you feel comfortable with this financially or not. If you don't, then here are other options. I would start with this, then do this, then do this. So I think it's important to not make assumptions and offer everything and the best care that you can, but then also give people an out because you don't want them to be embarrassed. And I do tell them, I'm like, there is no judgment here. No judgment. You tell me what we can work with and we will make that happen. So, and we do have a little bit of leniency at work of like helping a little with, you know, cost of exams or things like that. Or if, you know, an animal's just here for euthanasia to do a courtesy exam. Like we try when we see that people don't have the finances. I do work for a big corporation, but we still have a little bit of room to wiggle to try to be good human beings as well.
So important.
So I just think that honesty and just giving people an out. Don't make them feel like you're judging them if they don't have money, because I've heard sentences like, I don't know, they only have $3,500. $3,500 is tons of money. Do you know what I mean? Like they only have it because the estimate was 10,000, but 35, if someone told me to pay $3,500 right now to pull out my wallet, that is so much money. Yeah. So I think we also have to remember that because we're talking about thousands and thousands of dollars sometimes, right?
And often in an ER setting, the prognosis is very guarded or the outcome isn't positive. So how do you handle situations where the outcomes aren't good?
When the outcome wasn't good or when I think the outcome isn't going to be good, because it's two different things.
Well, let's do both. When you think it's not going to go to plan, or you owners are really insistent that they want to try. They want to try, you know, and I think that's a reasonable approach, because we do have a lot of owners who come in and say, do everything. You know, they really, really want you to try, even when you're going, this is not going to end well. And, you know, I want to try and protect them from that. How do you approach those situations? And then we'll do the other.
So first of all, I'm super honest, and I tell them that. I say to them, hey, I'm going to be very honest and very straightforward with you. And I also always tell them that people want percentages. We all do, right? That's the way our brain works. I don't have them. I tell them from the beginning, I do not have percentages. And then I tell them, and I am brutally honest, and people appreciate that so much because I try to do it in the best, you know, in a nice way, not in a mean way or anything like that. And I say, you know, we can try everything. I'm worried and I don't know if this is going to work or not, but I completely understand why we want to try, and I want to try too. And I even sometimes say, you know, if you're okay spending X amount of money, knowing, and at the end of the day, your dog might not come home with you, and that realization that money will be spent and you might not sadly go home with your animal, I just need you to know that might be a possibility. Because there is this, you know, oh, if I spend more money, my animal for sure is going to make it. And sadly, again, our medicine is private medicine, right? It's associated with cost. We're lucky in Canada. We don't pay for healthcare here. And so I just try to make sure that they know that. But I also tell them that I have been surprised, for better or for worse, in ER throughout the years, right? There's those cases that you're like, there's no way they're going to make it. And then they pull through. And you're like, yes, this gives me hope, right? And then there's cases where out of the blue, they decline where you thought they were doing better. So I try just to be honest about both of those options with people. But I always tell them, I always think it's worth a try. I always think it's worth a try, because if you're okay with the cost associated with it, and you're okay mentally also with this time that you're going to be in the gray zone, not knowing what's happening, and you're going to be scared, and you're going to be holding your phone the whole time, then let's do it, because it's worth it.
I mean, there are certain cases where you look and you say, this is bad news. What are the ones that come in and you're just like, I have to tell these owners now?
So my biggest one is there's like the one that it's clot cats, where I'm like, no. We've treated a few, but that is one that I'm very straightforward with owners, and I tell them, I'm like, there's heart disease associated with this. We can't fix this. They're in so much pain. And the ones that I've seen that we've been able to get them to leave the hospital have not had a good quality of life. So that for me is a big one where I don't let that go. And if they still want to try, we'll do it. But I find the hardest conversations are the really, really, really old geriatric animals that their quality of life is not good anymore. And the owners want you to do everything. Because my pet peeve a little bit is animals being hospitalized just to give it a shot where and you tell the owners that it's not, and then they pass away in hospital and not at home or with their owners. Mm-hmm. And I tell people that, and I say to them, you have to think about the quality of life the way it was before today, let's say, where they really declined. And also, if they pass away here while we're trying to do all these things, that the likelihood for them to work is really, really low. And anyhow, the quality of life wasn't good. Do you want them to be with us, or do you want to be with them when they pass away? And I tell them, I don't know if you'll be able to get here on time. And I give them my honest opinion, because it's the 22-year-old kidney cat that looks like it hasn't been eating well for months, and it's doesn't look good, and it's vomiting every day, and their quality of life isn't good, but these owners, it's their cat and they love it so much. But I like to use the sentence that we are very advanced in medicine now, and we have a lot of diagnostics we can do and all these things we can do, but is it the right thing to run all these diagnostics if we're not going to treat? Or is it the right thing to put your animal through being hospitalized and poked and prodded and woken up in the middle of the night if at the end of the day their quality of life isn't good in general? So that because I'm pretty brutally honest in the
those are
room.
very good examples,
and people appreciate it.
I can imagine. I think from my experience of doing ER work, that saddle thrombus, that for me probably is the hardest, because they don't come in where they've had time to anticipate it. So they don't understand. They haven't seen this before. It's like, what do you mean that this is the end of the road? It's out of the blue. Obviously nobody wants to let go of their 22-year-old cat. There's a relationship, there's a bond or whatever. But the cats, those saddle thrombus cats are heartbreaking.
I know. Those, they break my heart. And on ER, we see a lot of these sudden, or the hemoabdomens or the pericardial effusion that they were fine, and then they collapse on a walk. And out of the blue it happens. But they were fine a second ago. And your heart and your brain, you just can't comprehend what's happening. Those are the heartbreaking ones, because people are shocked. I would be.
Yeah.
Right?
Yeah.
Like, if God forbid that happened to one of my animals, I would be shocked. I wouldn't know what to do. I would want to do everything.
No, I agree. It's terrible. And I think, that's why that compassion within sort of those consults is so important, because, sometimes in ER work you can, and I talk for myself, I'm not for you or any of your colleagues, but you can become quite mechanical about it. It can be a bit of a survival strategy of like, this one needs my my frame of mind to be very sort of, like you say, with it. And I can't fall apart at this point, or I can't put myself in their position and imagine this is my cat, because I need to continue with this evening, and I need to see my next patient. Yeah. So, and you sometimes can miss the whole cues of actually supporting owners through what is just a dreadful situation.
The hardest question is when people ask you, what would you do if it was your
Yes.
animal?
Yes.
I'm like, don't ask me that because I most likely would do everything. I wouldn't be thinking straight. But that is why every time something happens with my animals, I ask one of my friends to help me because I can't think straight. But like you said, in those exam rooms, you have to also be objective. You can't put yourself fully in these people's shoes. Like you have to be their voice of reasoning within this as well, right? Because it's not my animal, because I would be sitting on the floor crying right now if it was my animal.
So how do you support those owners when things don't go to plan? What is your general approach to managing the delivery of bad news?
I walk into the room usually and I say, I'm sorry, but I have some bad news. Like I'm straightforward, but try to be as empathetic as possible. And I say, I'm sorry, this is what's happening. And I ask them usually, do you want a few minutes, especially if there's multiple people in the room, or I say, do you want to call someone? Is there someone, you want to talk to, just that you need the support right now? And then I can come back and we can talk about options. Or do you prefer talking? Like I ask them what they need, basically. And I also understand that they maybe hear a quarter of what I'm saying. So I try to repeat what I'm saying a few times to make sure that they understand. Because studies have shown that when you're in stressful situations, you don't really comprehend everything that someone, especially a doctor, is saying to you. So I offer them, I say, do you need those few minutes, or would you like me to talk about options right now? And I just listen to what they say, and according to what they need, or step away and give them a few minutes and come back and then kind of reiterate what's happening and do it again. Or we talk about options then and there, and then I'll give them a few minutes. I always try to step away no matter what and give them a few minutes to take in what's happening before they make their decisions. Because these are huge decisions that you can't, not especially when that minute you got that bad news, right?
I think that's a great approach. I really do. Can we discuss and go back? You touched on it before. Why is emergency care often so expensive? And what do people misunderstand about the costs?
So I think, again, especially in Canada, you don't know, we don't pay for healthcare, first of all. So we don't know prices of things. So let's say in the US, I don't know how it is in South Africa, but in the US, people are a little more aware of hospital bills, like because of themselves going to the emergency room. So that's number one. When we have free healthcare here, you have no idea how much things cost. But I think what people don't understand is the amount of tests that you do and what happens within the hospitalization, right? They think, my animal's just hanging out there, but it's not. It's the facility, it's the, let's say, oxygen they're getting, it's the medication they're getting, the IV fluids, the staff that you're paying. It's just everything at the end of the day adds up to be so much money. And it's like in anything, right? When I go fix my car, I don't know how much things cost, right? I have no idea. I don't know how much they're paying the people. I don't know how much the brakes cost. I don't know these things. So, but I think when it comes to medicine, we make kind of more of an assumption, but when you go to other places, you don't think about it the same way. At least that's the way I've experienced it. I don't know about you, but I think just the general public does not have the knowledge of what things cost within this. And that sentence of, if you loved animals, you would save them all. Believe me, my dream is to win the lottery and open an animal sanctuary and just, I was like, I'm that person that you would see running around with 5 million animals, right? But this is still a business, not for me, I go to work, but this is, no matter if it's corporate owned or privately owned, it is still a business, no matter how much we love animals. And I think it's really, really hard to comprehend that for all of us.
Yeah, it is difficult. I mean, even in South Africa, we've got a combination. Some people obviously pay for their own medical care, but a lot of people have an insurance policy where they pay part or it's paid in full. And so I don't think you ever get a real impression of what a hospitalization costs because you don't see those figures. So I think in a very similar way to Canada, we have that where owners just don't understand the cost of medical care. And so it comes as a shock, or they don't understand that our hospital setup is the same cost. The equipment costs the same as a hospital, as a human hospital. We're using the same quality and standard of equipment and medicine and expertise. So it's quite a difficult one to explain. But hopefully, more conversations like this will also provide some clarity around the cost conversation.
And it's a hard, right? Like money is hard to talk about in general. Like, I don't think anyone really likes to talk about money, not in any aspects of our lives, right? But I'm also a huge advocate for insurance, and I think it's getting bigger and bigger. Like, I tell people, and I tell them I have no affiliate with any insurance company. I don't work with anyone. I have insurance for my 2 dogs because I know with my hospital discounts, with me being a doctor, I know that if anything big ever occurs, I can't just drop $20,000. So I have insurance for those times where if I have to bring one of my dogs into the hospital, then I know it will be covered or partially covered, right? And I won't have to spend $20,000. I have to spend $2,500. And so I tell people all the time, I'm like, at least look into it and see if it's something that you think you can afford on a monthly basis, or put money aside. That's what I did as a student. Yeah. I put money aside every month, knowing that, I as a student, I had no money. I just going more and more into debt, right? But I knew that if I needed to pay for one of my animals, that I had the means to do it, or at least partially do it.
Yeah, so important. And I think, it's often these kind of situations occur and then people go, I wish I had, and that's what we want to avoid. And we try and talk about in general practice is sort of saying, when the nurses do those consults and they cover the microchipping and nutrition and tick and flea and whatnot in the insurance conversation, it's like, it's very important to say, we are not given any kickbacks for making this recommendation.
Nothing.
This is to try and support you. And obviously, yes, I mean, the only kickback it has is that we're in a position then to help you. We want to be able to do that without it being a huge financial stress on you if it occurs. So, I mean, even if it's for emergency care, I think it's just so important. Like you can often anticipate, my pet needs a dental scale. You can save up for that. It doesn't have to happen tomorrow. But, you can't snake bites and, those sort of cases, the ER cases are ones that always just come at a point where, like you say, end of the month, you've got no money. We all feel it. So it doesn't matter your circumstances.
Yeah. Right after Christmas, when you just bought all the gifts, right? Like it always happens like that.
Time, I know. So obviously we're running out of time and you're a very busy lady. You're on your way to a shift, so I don't want to keep you too much longer. But what should owners do immediately if they think that their pets are in an emergency situation? What is your advice when you get that telephone call and they're like, I think there's a problem?
So first of all, again, I think it depends on the emergency. I always tell people, like, we have like in North America, the pet poison hotline and things like that, or like the poison control. So first of all, number one, our advice is always to call, because sometimes it will save them an emergency visit. So a lot of times, because it's things that an animal ate. So that's number one. So to call, even if you're on your way, because it might save you money at the end. They're gonna be like, oh no, everything's fine. You're worrying for nothing. But also just call us. Call. There are such good, at least I know our hospital, they're so good at trying to triage things and help people understand if they need to come in or not. And at the end of the day, never stay at home if you're worried. So even if it means you're just being checked by a vet, you do no diagnostics, nothing, come in and do that, because it is going to make you feel so much more comfortable. And that way we can also, not miss the big things, right? What if it's something that now will be so much easier to treat, but if you sat and waited on it for a few days, then it's not anymore, and it can become something so much bigger. So, and trust your gut.
Yes.
My biggest thing I tell people in rooms, because, it's the obvious, oh, my dog's coughing, and then they come in, the dog's not coughing. I'm like, I believe you, first of all, and trust your gut. You know your animal so much more than I do. I just saw them for the first time. So yes, I have my skills and my physical exam and all that, but you know your animal. And if you're telling me your dog is off, then they're off, right? And one more, always film it at home.
Great advice.
Like, oh, he had a seizure. And I'm like, I know it's the last thing you're thinking about, but try to pull your phone out and take a video of it, because if they're not doing it when they come into the hospital, then I'm not seeing it. But if you show me, I can at least try to identify what was happening there. So it really helps. So pictures, videos, everyone's so apologetic. Oh, I'm so sorry. I'm showing you the picture of poop. And I'm like, no, give it to me. It's great. I can see what's happening. So those are two big things, is trust your gut instinct if you think something's wrong, and film it. Everyone has a cell phone.
They do, and they like to use it generally, so.
Right? Yes.
Thank you,
exactly.
Brianna. This has been such an incredible conversation. I've thoroughly enjoyed it. It's really, really insightful, and hopefully it has resonated with the listeners. If people want to find you, where can they find you? Obviously, you put out incredible information on social media. Where can they find you?
So it's Emergency Pet Vet. I'm mostly on Instagram, a little less on TikTok, but
we'll put it in the notes so that people can click and see. But thank you so much for your time. Good luck with your shift this afternoon. It's been really enjoyable.
Thank you so much.
And we'll be following you on social media to see the kind of working cases that you're doing and all the educational content. So brilliant.
Thank you.
Thanks again.
Thank you so much. Have a great day.
Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.